Vanakkam, good morning. In this video, we are going to discuss about the periodic breathing. Two types of periodic breathing is there. First one is the stokes breathing. Another one is the Biot's breathing. Stokes breathing. So this is the rhythmic hyperapnea and apnea is occur. This is the most commonest type of the periodic breathing. So in the stokes breathing, during the apnea, carbon dioxide is accumulated, it stimulates the respiratory center, so it produces a gradual increase in the hyperventilation. It is called as the waxing phenomenon, and gradual decrease in the ventilation, that is called as the waning phenomenon, due to the gradual wash out of the CO2, and complete wash out produces the apnea. Again, CO2 is accumulated, it produces the waxing waning phenomenon of the hyperapnea. This is one of the most peculiar feature of the stokes breathing. Stokes breathing also produced by some physiological conditions like voluntary hyperventilation. After the voluntary hyperventilation, we can see the stokes breathing. Due to the voluntary hyperventilation, carbon dioxide is washed out, it produces the apnea, and again it produces the hyperapnea with the waxing waning phenomenon. So we can see the stokes breathing after the severe muscular exercise, and during deep sleep very rarely we can see the stokes breathing, and high altitude also sometimes produces the stokes breathing. Stokes breathing also produced during the pathological conditions like increased intracranial pressure and cardiac failure, advanced cardiac failure, and uremia with severe renal failure in premature infants, and narcotic poisoning also produce the stokes breathing. In Biot's breathing, this is another type of the periodic breathing. Yes, the hyperapnea and apnea, regular hyperapnea and apnea, and no waxing waning phenomenon occur in the Biot's breathing. Waxing waning not occur in the Biot's breathing, and Biot's breathing always occur in the pathological conditions. It will not produce in the physiological conditions. Always pathological. In meningitis, inflammation of the meninges of the brain, and lesions of the medulla of the brain, increase intracranial pressure, and morphine poisoning produce the Biot's breathing. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.